Peichieh has joined us. This presentation is on fighting fatigue, Fatigue 101, nutrients for energy. And we all know, especially those of us who are in cancer treatment or cancer survivors, how important this is. But I would guess that whether or not you're a cancer patient, fatigue is something many of us experience throughout our lives, especially as we get older. And I think this will be helpful information no matter what. Some housekeeping items before I introduce our speaker today. I do want to remind you all that this is being recorded. If you do not want yourself seen or heard, you can use your buttons, usually on the bottom of your screen, to mute and or close down the video portion of what you are presenting. And we will have questions when Peichieh is done with her presentation. Please unmute yourself. That's that little microphone again at the bottom so that we can hear you and hear what you have to say. So again, we are delighted to have you. Welcome to Eisenhower Health, Lucy Curci Cancer Center, and our Cancer Lecture Series. Let me tell you a little bit about Ms. Wu. She has her master's degree as a registered dietitian. She started her career in 2011 when she became a registered dietitian, got her master's in science in nutrition in 2011. She did her internship at University of Michigan in Ann Arbor, and even though I'm a Michigan State graduate, I will forgive her that, and that's just fine with me. And she has a Bachelor of Science in Food Science and Human Nutrition from Colorado State University. She is also ServSafe Food Safety Certified. Peichieh brings a wealth of experience and information and a big picture view of how and why to stay healthy and why it's so important when we talk about fighting cancer with a fork. So I will get out of the way and hand this over to Peichieh, and thank you.
Thank you. Thank you, Ali. Hi, everyone. This is Peichieh. So this is our third series. Today we're going to talk about Fatigue 101, Nutrient for Energy. And then we will leave some time at the end for question and answer. So we'll just jump right in. So today we're going to be talking about your energy level during and after or before cancer treatment. So I just want you to check in with yourself throughout this whole lecture and then just see what kind of energy level are you at? Are you feeling tired, weak, or exhausted? Sometimes it's also good to write down and keep a diary of how you feel, how you eat every day. Later, we'll also talk about how much calories and nutrients does a cancer patient need. Since everybody is very different through their treatment or through their different type of cancer or your energy level, everybody has different needs. So eating nutritious food is more important than ever for cancer patients before, during, and after treatment. So not getting enough calorie or the right calorie can add to fatigue, and choosing the right food can make a difference and may help with cancer-related fatigue. So for example, avocado is a really good option as a nutrient-dense food. If you are having low appetite and can only eat a little bit, if you're not allergic to avocado, avocado is usually one of the great fruits that provides a large amount of calorie, protein, and fat, the good fat. So causes of cancer fatigue. So like we mentioned, there are many causes and many factors. And these factors contribute to your cancer fatigue. It may be different from yourself and others. So we'll talk about a little bit of what type of factors that can possible possibly contribute to your cancer-related fatigue. So first of course, it will be your cancer, different type of cancer change to your body that can lead to fatigue. And the cancer treatment, so chemotherapy, radiation therapy, surgery, or bone marrow transplant, and biological therapy may cause fatigue. And the third one is the medication. Some medication will cause fatigue, such as pain reliever, or some of your chemo therapy drug can cause fatigue as well. Another one is anemia. Some of the treatment will destroy some of your red blood cells. So you might develop anemia if your treatment destroy too many healthy red blood cells. So if your body is not having enough red blood cells, the red blood cells cannot carry oxygen to your body. And later we'll talk about how oxygen related to fatigue, how red blood cells is essential for transporting nutrients. And when you are performing daily work, for example, just sitting and breathing, that also costs energy. And red blood cells is really crucial for carrying oxygens and nutrient and circulate and even eliminating waste inside your body. The next one is pain. If you're experiencing chronic pain, you may be less active, eating less, sleep less, and become depressed, all of which may add to your fatigue. If you're not exercising, then your body is not eliminating waste, and more waste is building up inside your body, and then your body will feel like there's a big load. Then you will feel fatigue. The next one is emotion. So a lot of people might feel anxiety, stress, or depressed because of your cancer diagnosis. So these mental health, sometimes it may also lead to fatigue. So because some people, if they're experiencing depression, they might not want to go out, they might not want to be active, they might not sleep well. Same as stress. Stress is also adding some stress to our cells, and it will cause some internal damage to our healthy cells. So the next one is lack of sleep. Like we mentioned, if you're not sleeping enough, sleeping less at night, or your sleep is interrupted, of course, you will experience fatigue in the daytime. So usually we will recommend if you are not able to sleep well, you can definitely talk to your doctor and see if it's because of the medication, or if you have sleep apnea, or if it's a good choice to start some medication to help you sleep. Or we usually recommend you to take small naps during day, but don't take long naps. So small naps during daytime is okay if you're not sleeping well and have frequent interrupted sleep at nighttime. And the next one is poor nutrition. So in order for your body to work efficiently, you need the energy that healthy diet provides. So if you're not getting enough nutrient, your body cannot function normally. So in a previous lecture, we mentioned that it is highly recommended to eat a rainbow diet. So the rainbow diet shows on this slide. So it has all the colors for fruits and vegetables. Also, rainbow diet actually include the color white, which will be mushroom, and color black, which is also, for example, mushrooms and other potato, for example. White is also in the rainbow color. So if you're able to eat a rainbow color diet, that means you have a higher intake of vitamins and mineral, which we will talk about it in a little bit as well. So if you're getting enough vitamins and mineral from your rainbow diet, then you will get enough nutrition. And as well as besides the rainbow diet, we also later talk about how much macronutrient that you will need, which is protein, carbohydrate, and fat. The next one is hormonal changes. So hormonal therapies are a common method to treat certain cancer, and these change in the hormones in your body can lead to significant fatigue. So for example, normal hormone changes also may occur as a side effect of treatment such as surgery, radiation therapy, or chemotherapy. So, for example, change in the thyroid gland, adrenal glands, or ovaries can also cause fatigue. So it just really depends on what kind of treatments you're getting. So for cancer patient, this picture shows the most important nutrients that we want to focus on. So some essential nutrient will be vitamins, minerals, protein, carbohydrate, and fat. But for cancer patient, we usually focus on how much calorie you're getting total, and high quality protein, and nutrient dense food from protein, and then of course vitamins and minerals, because vitamins and mineral act like a helper in our body. So our body is like a factory. It needs worker to work and transport nutrients. So vitamins and minerals, some of them act as a transporter. It transport and assemble different type of hormones, protein, amino acid, that's essential for our immune cells or red blood cells to function. So nutrients are the substance needed for growth, energy, and other body functions. So it's important your body gets the essential energy and nutrient that it needs so it will function properly. So how much calorie and nutrient does our body needs under cancer stress or during the treatment? So this picture is choosemyplates.gov. It is the new, fairly new guidelines after the pyramids. If you remember back in the day, there's food pyramids. Now it's easier to understand of what you need throughout the day. So if you have a plate for your either breakfast, lunch, or dinner, we want half of it on the, if you look at the picture, half of it on the left-hand side is fruits and vegetables. And the other half is divided into each quarter is grain and protein. And on the side, you can see that's the dairy, which is mainly for protein as well, can be from cows or can be from soy or soy milk, cow milk, or rice milk, or there's different type of milk out there for dairy substitute. But going back to the big plates, you can see grain is mainly the carbohydrate, which we will show you a little bit more later, and protein, which is egg, fish, chicken, beef, beans, plant-based protein also counts as well if you're vegetarian. So it is very important that actually half of your meal needs to be fruits and vegetables. And for the easier guideline for adult women, it's recommended that you eat 7 serving of fruits and vegetable throughout the day. And each serving will be about one of your fist size. And for adult men, it's recommended to eat 9 serving of fruits and vegetables throughout the day. And also, each serving will be your fist size. So, for example, 1 apple will be 1 serving, 1 banana will be 1 serving, 1 cup of spinach will be 1 serving. So, now let's look at into more detail of how to calculate how much calorie you need throughout the day. So this is a very simple calculation. Your body weight in kilogram times 30 to 35. Sometimes is 25 if you're overweight or obese, or sometimes times 40 if you are going through extreme therapy that actually requires a lot of extra energy. So, for example, if you're 150 pounds, how to get to kilogram is divided by 2.2. So, if you're 150 pounds divided by 2.2 is 68 kilogram. So 68 kilogram times 30 will be your total calorie that you need throughout one day. So it will be 2040 calorie per day. So if you're eating 3 meals per day, then you divided that with 3. So each meal you can go around 600 to 700 calorie for your each meal. And this number times 30 times 35 times 25 times 40 varies. So it is also recommended that you talk to your dietitian and figure out what's your personal need for your calorie, and actually what's your personal need for protein as well. So macronutrients are carbohydrate, protein, and fat. So these are the nutrients required in large amount that provides energy needed for maintaining body functions and carry out the activity of daily life. So the macronutrients is carbohydrate, protein, and fat. And these are the ones that actually produce energy, meaning that if you burn these items, they will actually create heat, create energy. Because if you burn vitamins and minerals, it doesn't really create energy or heat for our body to function. They're more like helpers. So carbohydrate, protein, and fat. So carbohydrates are shown in the picture: bread, rice, pasta, starchy vegetable. Corn is considered starchy vegetables. Potato, yam, beans. These are all mainly carbs. Protein is what you know that it's meat. So fish, poultry, pork, beef, milk, cheese, egg. Some of the beans, they have actually quite large amount of protein. So nuts and seeds and beans also will be considered part of the protein. And the fat will be, of course, oil, butter, also the fats that's around the steak, or the one that's, for example, for chicken, the skin part will be fats. And for coconut oil, even salmon has a lot of fat. So these are the sources that you can get your macronutrient from. So besides macronutrient, we have micronutrient. So macro means large and micro means small. So smaller amounts or smaller in molecule sizes. So this is a very, before my plates, usually we will see my pyramid before my plate. So this is what you need before the my pyramids. It shows the largest amount that you need is water. and the macronutrient, and on top is the vitamins and minerals. So vitamins and minerals are micronutrients. So if you have deficiencies in vitamins and minerals, or even hormones, many individual that might have deficiencies in, that can lead to chronic fatigue and lethargic, include commonly seen iodine deficiency. So this is essential mineral commonly found in seafood. Your thyroid gland use it to make thyroid hormone, which help control growth, repair damaged cells, and support a healthy metabolism. So if your body is constantly working and repairing damaged cells, it needs a chain or a mechanism to help your body release and then eliminate the waste. If your waste is not eliminating properly, like we mentioned earlier, your body will start feeling a huge load of waste and start getting fatigue and getting tired, feeling foggy. Thyroid hormone is very essential for your overall health metabolism, which means it will bring in new nutrient and then eliminates the waste. The next one is very commonly heard, vitamin B12 deficiency. Some of you might be on B12 supplement. So if you have B12 deficiency, it can cause depression, dizziness, and fatigue. And also vitamin B is a water soluble. All vitamin B's are water soluble vitamins. So if you take it, there's no concern that if you take too large amount, because they will always, your body will eliminate it with your urine if you are taking vitamin B, and your body will just only uptake whatever your body needs. And the next one is vitamin D and magnesium. All those help to regulate your body muscles and your bone. And then especially if you are feeling fatigue, your muscle will be feeling sore. Magnesium has help with muscle contraction. And for coenzyme Q10, later we will talk into more detail about it. Coenzyme Q10 is very essential for our cells. There's a little thing called mitochondria inside our cells. It's more of a power plant that produce energy for our cells. And coenzyme Q10 is an essential ingredient for the mitochondria. And the next one is melatonin. If you are deficiency in melatonin, it might interrupt your sleep. It's one of the hormones that regulate our sleep during the nighttime. So vitamin B12 is a powerhouse vitamin for energy and tiredness. It is often found in fish, meat, egg, and dairy. So vitamin B12 is an essential vitamin that helps cells to produce energy, form red blood cells, support neurological function, bones, and heart. So earlier we mentioned if you are anemic, you don't have enough red blood cells, then we might also look at having the patient supplement with B12. So it is more of a chain reaction, and then we will look at in the big picture what causes what and what you're lacking. If it's red blood cells or vitamin B12 or iron, and to see what is causing what, so then we can make personalize your recommendation. So it is recommended to take vitamin B complex daily, just for maintaining a normal healthy metabolism, even for healthy patient or a healthy individual. Vitamin B has many benefits. It not only increase your energy, it also enhance your mood, improve your memory, and help with skin, hair, and stimulate immune system, and then form red blood cells. So vitamin B complex, which include vitamin B1, B2, B3, B6, B12, and so on. So vitamin B complex includes all the vitamin B. So it's recommended to take during daytime every day. So the next one, we're going to talk about nutrients for more energy, because for earlier in the calculation that we see that your body weight in kilogram times 30 or 35 or even 40 for cancer patient. Usually for a healthy individual, we usually do your body weight in kilogram times 25 will be enough for a healthy patient. So for cancer patient, we will do your body weight in kilogram times 35, 30, or 40. So you definitely need more energy if you are a cancer patient or undergoing certain treatment or been through surgery, that you need extra calorie and extra protein for recovery. So here are some ways for more energy. Energy comes from protein. So think about it as your body is a car. So your body definitely needs, your car definitely needs gasoline to run. And so the gasoline will be considered fat and carbohydrate. So starchy food, rice, pasta, bread, and fat will be oil, butter, or the fat from the fish or the meat. And the protein is also considered essential ingredient for your engine. So protein is more of a high quality oil for your engine, for your car. And then so after you drive your car for a while, definitely you need to check your oil. So you need to do oil changes, because the oil for your car is designed to help smoothen out and transport all the function that needed to run a car. So think about vitamins and mineral is the engine oil that you need for maintaining and keep your car running. So everything, fat, carbohydrate, protein, the macronutrient, and the micronutrient, which is vitamins and mineral, they all need to work together to sustain and maintain a healthy body, like maintaining your car. So then now let's look at what happened when your car is running. So when your body is functioning. So let's see. Okay. All right. So okay. So for example, if you're running, or just say if you are walking, or you can even think about if you're just sitting, if you can't do exercise. As long as you're breathing, this all counts. So when you can look at the picture. If you are if you are breathing in oxygen, so the oxygen will go into your lungs, and then your heart will start pumping blood throughout your body, which means your body needs oxygen to operate. So Iron on the right side is one of the most important vitamins and minerals that we need to supply and store oxygen around the body. So iron is bind with the red blood cells. So earlier we mentioned if you are anemic, then your red blood cells is less, then your body won't have enough iron, or vice versa. If you don't have enough iron, uh, then your red blood cells won't function properly, or it won't carry enough oxygen to supply oxygen throughout your body when you are breathing. And the next one is vitamin B complex, which we mentioned earlier. So when you're exercising, vitamin B complex will help break down sugar and fat for energy. So when your body is breaking down sugar and fat, so your muscle can start moving around, they need vitamin B complex to act like a worker, so your whole body can move properly. And the next one, when you combine the oxygen and the energy, then you can start performing some exercise. Um, and when you are able to combine these nutrients and the function in your body, you need coenzyme Q10. Earlier, we mentioned if you are having deficiencies in coenzyme Q10, um, your body won't have energy metabolism, so your body won't function. So it's like mitochondria is our power plant, and the coenzyme Q10 is the key to make mitochondria work. And then the next one is once you're breathing in oxygen, and then your blood is transporting oxygen, and then combine the breakdown of the energy, the sugar and fats. Now our body has used up the oxygen, which produce CO2, which is the reactive oxygen, what we will call, is the waste that happens when we breathe. Even when you're sitting down, it doesn't have to be running. As long as you're breathing, you're producing CO2. So some of the CO2 will be carried out through the lung. Some of the CO2 or the oxygenized waste will accumulate inside your body. So we need these antioxidants to help us eliminate those wastes. So in the first lecture, we mentioned different types of antioxidants. So these are the most commonly seen antioxidant that we see throughout the daily life. And these are also easy to get and essential for our body. So we all heard about vitamin C. So vitamin C is a very good antioxidant. It is recommended to take every day. Vitamin E is also essential. Beta carotene is vitamin A, and they're mostly found in carrots because of the color. Anything that is carrot color, orange, red, or yellow, they have some sort of different type of vitamin A and beta carotene. And selenium, zinc, and copper, these three are very crucial minerals acting like antioxidant in our body. So these vitamins and minerals are very important for our normal body function. And the last few ones are calcium, vitamin D, magnesium, and zinc. These are the bone, essential for the bone structure, of course, that you need to maintain exercise or even normal daily task. Okay, So this is a picture on the right side is the picture of our cells. Um, Not all the cells in our body look like this, but each cells has all these little factories and different ingredient inside our cells. So the one in the center, this is the heart of the cell. So this is the most important part that contain our DNA. And the mitochondria that we've been talking about all day today is this red, orange, little worm looking structure inside our cells. This is the power plant that produce energy in order for the cells to operate. So if we don't have coenzyme Q10 or vitamins or minerals to operate this mitochondria, the whole cell will be dead. There will be no energy. It will be functionless cell. So your mitochondria holds the keys to your energy production, but they need helpers. So certain key vitamins and nutrients for production of energy. So these helpers we're going to look at. Earlier we mentioned coenzyme Q10 is the one of the most important key nutrient for mitochondria. So every cells of your body needs CoQ10, which is the coenzyme Q10 to produce energy. And this is also antioxidant that's found in organ meat, fish, and peanuts. Our body tend to produce less coenzyme Q10 as we aged, or if we're going through chemotherapy or different type of disease. As you commonly heard, heart-related cardiovascular disease, sometimes your doctor will recommend you to take coenzyme Q10 if you have heart problem. And fatigue is one of the primary symptoms of coenzyme Q10 deficiency, as we mentioned earlier. So you can look at this picture. So this picture, so this round oval thing is part of our cells. And here. And this green one is the mitochondria. And then this little tube is the bloodstream. So this little pink round one is the red blood cells. So red blood cells will flow through and then drop off oxygen and drop off vitamins and mineral and nutrient to our cells. So if we have a proper channel to drop all the nutrients and oxygen into the cell, then cell will produce ATP, which is energy. But if the red blood cells is not able to drop off, or your body is not having enough nutrients, transporter, or vitamins and mineral to transport these nutrient and oxygen, then your mitochondria won't get these helpers and it won't produce enough energy. So these happen in a lot of metabolic disorder patients, or patients that their metabolic is being disrupted. Okay, so that's a picture showing you how mitochondria work. So besides Q10, mitochondria needs other helpers as well. B complex, we mentioned earlier, it has vitamin B1, B2, B3, B12, B6. Magnesium, we mentioned earlier, zinc as well. Magnesium is also a mineral that's needed. Glutathione, it is a really good antioxidant, especially for our stomach. And the next one is A and D. it is also driven from vitamin B3. So if you are taking vitamin B complex, you're supposed to get all the vitamin B you need. And the next one is alpha lipoic acid. This is also a very powerful antioxidant. So antioxidant has many different type of functions and different type of antioxidant that we need throughout our body. So let's see. Yeah, so our body will needs different type of antioxidant. It's more like, for example, if you are playing different type of sports game, for example, if you're playing baseball, you need different type of equipment to play with that sport. So you need different type of antioxidant to interact with different type of oxidation process in your body while you're exercising or just doing normal breathing or undergoing treatment. So this is a very quick information of what we talk about today. So I'm gonna leave some time for Q&A. So we can unmute everybody and then we can see if you have any.
I've asked everyone to go ahead, everyone, and unmute your microphones. You've been asked to unmute them. If you'd like to ask a question.
I have a question. I have a question.
Okay, go ahead.
Me? Can you hear me?
We can hear you. Uh-huh.
All right, let me ask you. They told me that cancer thrives on sugar, and you're saying eat a lot of fruits, eat a lot of white stuff that has a lot of sugar. It's a fine balancing act, and it should be good sugar. And you can't eat that much fruit.
Yes, it's definitely good sugar. Mainly, it will be if you are able to avoid added sugar, then that will be the first priority because everything that we eat definitely has carbohydrate, sugar in it, besides fat and meat and protein. The rest of the food item we eat always have sugar. So the main thing that we want to focus on and put as priority is to avoid added sugar. So if you're buying any pre-packaged food product, you will always see a food label, nutrition fact, and under nutrition fact, it will show sugar, how many gram, and added sugar, how many gram. So
then you did mention something like Ensure 30 grams of protein.
Ensure, you mean the Ensure protein shake?
Yes.
Okay, yeah. So Ensure has different Ensure has different amount of
30 grams.
Yes, so 30 each person has different needs for protein. So 30 gram will be considered part of your needs. Usually it depends on your weight. We will calculate how much protein you need. So Ensure is a high protein shake that we usually recommend cancer patient or patient in general that has nutrient deficiency to supplement with.
Thank you.
I have a question.
Yes.
My name's Jim. I'm a care partner for Bill Rapkin, who has cancer, lung cancer, and he has no appetite. And I can't get him to eat anything. What can you he's on Kiruda, and I don't know if that's suppressing his appetite or what, but he won't, he doesn't want to eat. I try applesauce, Boost, bananas, anything, and he just doesn't want to eat.
Oh, okay. So, loss of appetite is very commonly seen as a side effect from either cancer, chemotherapy, or radiation therapy, or other medication. So, some of the doctor will prescribe appetite stimulant for the patient. Is he on any appetite stimulant?
Nope.
Okay. That might be some of the first thing you want to mention to your doctor, if he is refusing or no appetite to eat anything. So appetite stimulant might help. Another thing is change of taste usually happens as a side effect as well from chemotherapy. Is he experiencing that?
No chemotherapy.
Okay, so
No.
he doesn't have any change of taste.
No. I mean, he likes the chocolate Boost and the vanilla Boost, but he just doesn't want to drink them, or the applesauce. He likes the taste of everything. He just won't eat it.
Oh, okay. Yeah, so appetite stimulants will usually help with this condition.
What are some appetite stimulants? Are they over the counter or prescription?
No. Your doctor will prescribe you their prescribed medication. And then your doctor will tell you how to take it and how long to take it and when to take it.
Okay.
Yeah.
Thank you very much. I have a session with you coming up, but I'm not sure what date it is. I think it's an individual one, but I don't see it on my chart. You don't schedule or put your appointments on my chart?
What's the patient's name, Jim?
William Rapkin, Rapkin.
Yeah, he's scheduled on the 11th. No, these aren't billable visits, so it won't be on my chart.
Yeah, just the 11th at what time?
9 a.m.
9 a.m. Yeah, it'll be me probably with more questions, because he has aphasia, so he can't really communicate too well either. So
Okay. Yeah, definitely.
ask the doctor about an appetite stimulant. And so thank you very much.
Yeah, no problem.
Any other questions?
We can also go through, we can select one of you to do a calorie count of how much you need per day with calories and protein. Does any one of you want to share your weight and height and weight, and we can calculate approximate amount that you need?
I can tell you mine, I weigh 150 pounds. 155.
Uh-huh. Okay. So that's pretty close to the example that we mentioned earlier. 150 pounds will be about 68 kilograms. So if you divided 155 by 2.2, let's see how much it is. 155 divided by 2.2, it's about 70.5 kilogram. So are you going through any therapy?
Immunotherapy.
Okay. So usually, I don't want to ask you too much in detail because this is public. So we'll just use a very general information that
Sure.
you gave us. So 70.5 kilogram, 70.5 kilogram, that's just to times 35. So that will be 2,467 calorie that you need. And then that's do 70.5 times 30. That's 2,115 calorie. So it's about upper and lower limits. So your calorie needs will be ranging from around 2,100 to 2,400. So it's about like 300 different, which is reasonable difference. If you're monitoring your calorie intake every day, you'll be able to see what food has higher calorie, what food has less calorie. And going back to our first slides, the avocado, that you can see one avocado already has 322 calorie. So in between 2,100 calorie per day. And if you are counting your calories throughout the day and then you're seeing you're short a few hundred, then you know what food is more nutrient dense that you can use to add up the calorie that you need. And for the protein that you need, it's usually the kilogram of your body weight times 1 or 1.2 or 1.5. So to make it easy, just for now, if we times your body weight in kilogram and convert it into gram, it will be your daily needs of protein, which will be 60.5 gram of protein. That's how much protein you will need throughout the day.
Okay. Oh, that's good.
Yeah.
Okay.
So earlier you mentioned you have a Ensure Boost drink.
Yes.
That's 30 gram of protein. So you already have almost 30%, a quarter of what you need throughout the day, or
Yeah,
45% what you need.
they'd like for me to take more and more water.
Yeah, definitely. Remember the pyramid that we saw, I showed earlier. The pyramid, on the bottom of the pyramid is the water. Your body needs water as a transporter to transport all the vitamin, minerals, and all the nutrients throughout your body, to transport nutrient and transport waste. So water, definitely drink enough water. And how to calculate how much water you need will be, for example, 75 kilogram of your body weight times 25. So let's see how much it is. So that will be about 1.7 liter of water that you need to drink throughout the day.
How many ounces is that?
Okay, so let's do a calculation. So that will be about 57 ounces. So about 60 ounces.
Yeah, I'm drinking double that.
Okay, yeah. So that's the general recommendation amount for general healthy individual. So depends on your medication or therapy, you might need a little bit more than that. But this is the minimum that you need.
If I want to contact you, what's your phone number?
Heather will help you.
Okay.
Maybe an email to me. Do you have your chat open? I'll put my email there for you, and then I can get, what do you need to send? What do you need to do? What would you like to do?
Bill, is that Bill?
Yeah. What do you want from me?
Can you put your information on the chat room?
Yes, I put my email there for you, Bill.
I didn't see. It went off. I didn't see anything.
It's in the chat, so you have to go to the chat. It's there. Can everyone see it?
No.
Let's see. It's.
So I guess she works at Eisenhower Hospital. Just call them.
I do. Let me give you my phone number, Bill.
Okay.
760-674-3628.
Okay. Thank you.
Okay. What was your question, Bill? Did you want an appointment with Peichieh? What did you need?
I'll call her and make an appointment and set it up.
Okay. All right. I gave you my phone number to do that.
She gave me, yeah, go ahead.
Okay.
Thank you.
Is there any other questions?
I have a question. Can you hear me? This is Susan.
Hi, yes. Susan. Yes.
Hi. Is there a possibility to get a PDF file?
Did she got cut off?
We didn't hear your last portion of the question. A PDF file, Susan?
Of the slide that were used during the presentation?
Peichieh?
Could that be sent to an email?
Did we have to go through the recording service before we released it?
No, the PowerPoint is yours, Peichieh. So if you want to release it, that's your decision.
I can email you. Do we have your email on file, Susan?
In the chat here, Susan, go ahead and put your email address.
Is there a way we could do it off?
Yeah, go ahead and call me. Let me give you my phone number.
That'd be great.
Okay, 760-674-3628.
Thank you. Appreciate it.
You got it.
Yeah, the dietitian gave me the same number.
That's my number, Bill. I'm Heather. I work here at Eisenhower.
I know, but she gave me her number and that's it.
Yes.
So if I want to call her, I'll call you.
Correct.
What's your name?
Heather.
Okay, Heather. Thank you.
You got it. Any other questions?
That was very good.
Thank you.
Yeah, very nice.
So we have this talk series every first Tuesday of each month. And then it will be the same link, and you're welcome to invite any friends or patients that would need information regarding cancer, fighting cancer.
Right. The next one will take place Tuesday, December 1st at 11:30.
What's the topic?
It will probably focus on the Christmas healthy cooking.
Okay.
Yeah, don't eat too much.
We'll find a way.
Okay.
Thank you. Thank you, everyone, for joining us. And everyone has my phone number. If you have any more questions, you can go ahead and call. Thank you, Peichieh. We appreciate you coming on and giving us all this information. It was really great.
Thank you. Stay safe. Stay healthy. Bye.
Bye-bye.